I'm now delighted to introduce to you Dr. Thierry from Tobias Holl's lab in immunology. His presentation is The Fungal Kingdom Strikes Back.
So, hematopoietic stem cell transplantation is a potential cure for certain types of blood cancers, such as leukemias. During this process, high-dose chemotherapy destroys the patient's cancer cells. But this high-dose chemotherapy also destroys the patient's healthy blood and immune cells. These now have to be replaced by cells from a healthy donor. Unfortunately, during stem cell transplantation, things can go wrong. First, the patients are at an increased risk of severe infections. And second, the donor immune cells can actually attack the patient's organs and cause a severe inflammation called graft versus host disease. Now, I am interested in how fungi can impact infections and graft versus host disease. And if I talk about fungi, I don't mean your everyday mushrooms, but rather their microscopic counterparts, specifically the yeast. And to look at them, I sequenced the DNA of serially collected stool samples of patients undergoing stem cell transplantation. In the next step, I compute the composition of their microbial communities. Basically, like on the top of my slide, what I do is I take a poop census. And this poop census actually tells us a very fascinating story happening in a galaxy not so far away, namely in the patient's guts. Normally, a very large number of very diverse bacteria live in the guts, and they do a lot of things. But amongst these things, they protect us from the invasion of pathogens. Now, some of the patients undergoing stem cell transplantation receive antibiotics. While these antibiotics may be helpful, the antibiotics, very much like the Death Star on my slide, can wipe out the good guys, the healthy bacterial flora that normally lives there. And once the antibiotics have wiped out the bad guys, the stormtroopers of the fungal kingdom can invade the guts. And in the patients undergoing stem cell transplantation, these stormtroopers are a specific yeast called Candida parapsilosis. Once Candida parapsilosis has invaded the guts of the patients, it can go on and invade the blood vessels, causing very difficult to treat bloodstream infections. And second, actually the Candida parapsilosis in the gut appears to be able to trigger the donor immune cells to attack the patient's organs and cause graft versus host disease. So in summary, in my work, I can show that the use of antibiotics in patients undergoing stem cell transplantation can lead to the destruction of the bacteria that normally live there. In turn, this creates a place for Candida parapsilosis to invade their guts, and then Candida parapsilosis can cause the adverse events I talked at the beginning of my talk: infections and graft versus host disease. Many thanks.